Thank you all for being with us over the past 3 days. We have arrived at our last panel to close out our conference. I'm very excited to introduce the impressive group we have here today. These senior leaders are leading by example in their inspirational work on equity. You have their full bios, but I have to introduce them with a couple of words just so you really get a sense of how fantastic they are. I first would like to introduce Michigan's Lieutenant Governor Garland Gilchrist II. As part of the Whitmer administration, Lieutenant Governor Gilchrist has sought to address injustice and inequity across the state at every level. From co-chairing the Michigan Joint Task Force on Jail and Pretrial Incarceration to helming the Coronavirus Task Force on Racial Disparities, these task forces have taken actions that have saved lives and protected the state's most vulnerable populations. Lieutenant Governor Gilchrist's approach to addressing these disparities is deeply rooted in fact-based practices, science, and connecting with individuals across Michigan. Our next panelist is Chief Officer Karrah Herring, Chief Equity, Exclusion, and Opportunity Officer, State of Indiana, Office of Governor Eric Holcomb. In November 2020, Indiana Governor Eric Holcomb announced his appointment of Karrah to his cabinet as Indiana's first ever Chief Equity, Inclusion, and Opportunity Officer for the state. In this role, she works tirelessly with the governor and his team to improve state government operations, as well as remove hurdles in the government workplace and services the state provides. And then last, but certainly not least, I'd like to introduce the Honorable Dr. Janice Underwood, Chief Diversity, Equity, and Inclusion Officer in the Commonwealth of Virginia, Office of Governor Ralph Northam. Dr. Underwood was appointed by Governor Northam as the Commonwealth of Virginia's first cabinet-level Chief Diversity Officer. This position is also the first of its kind in the nation. As the Commonwealth CDO, she is committed to addressing racial, ethnic, disability, gender-based, and other cultural inequities in formal and informal policies and practices in Virginia state government. And with that, I would like to turn over to our first panelist.
Well, hello, everyone. And Hemi, I want to thank you and the entire NASHP team, not only for your introduction, but for putting together this collection of conversations and coming together about how we can move forward as communities and as a nation. I first want to acknowledge Dr. Marcella Nunez-Smith, the chair of the White House COVID-19 Equity Task Force. Her leadership at the federal level, the way that's being created by the Biden-Harris administration has really been transformative. And we in Michigan, and I think I speak for all of our other states as well, are so appreciative of the work that she's doing. And we are very proud that our own chief medical officer from the state of Michigan, Dr. Jonae Caldoun, is a member of that task force. I also want to acknowledge and show gratitude for my co-panelists, Dr. Janice Underwood, the Chief Diversity Officer from the state of Virginia, the Commonwealth of Virginia, excuse me. She's been a trailblazer in this space, and I'm excited to learn from her, as well as Chief Officer Karrah Herring from the great state of Indiana, working with Governor Holcomb as the Chief Equity and Inclusion Officer. So this is just an amazing opportunity to have a conversation about how we move forward. And I'm proud to do this alongside such public health experts. The truth is, the words public health have new meaning for all of us in 2021 and beyond. Just members of the general public now have, I think, a deeper understanding and experience of what those words means when they are paired with one another. Public health officials are now some of the most watched, respected, and sought after officials in American life. And that's a good thing. Public health has always been important, but this pandemic, again, has brought more clarity to just how important public health is. It is the cornerstone of healthy and vibrant and productive lives and communities. Now, early on in the COVID-19 pandemic, Governor Gretchen Whitmer and I recognized that here in Michigan, we needed to gather the best minds from all walks of life to respond to every aspect of what this virus had presented us. So since the beginning of COVID-19, it certainly shined a light on the historic and persistent inequities when it comes to health, economic opportunity, educational access, and how these challenges were particularly deep and persistent in the Black community and really most communities of color. These are things that people have been fighting with every single day for generations. And so when we, along with a team of public health experts, observed the deadly trends that presented themselves due to COVID-19 in our state, the disparate impact for this virus that was, killing Black Michiganders at a 5 times more than white Michiganders, we took immediate action. We chose not to wait. Black Michiganders couldn't afford for us to wait. Michiganders of color could not afford for us to wait. And so that's why, 1 month and 1 day after our first case of COVID-19 was discovered and identified, we established the Michigan Coronavirus Task Force on Racial Disparities, the first state to take such action, to have a full-throated statewide task force level response to address disparities specifically. And I'm proud to chair that task force along with some of the brightest minds in our state. This work is deeply, deeply personal to me as someone who has said goodbye to 27 people during this pandemic in my life, most of them Black folks in Michigan. So the task force is prioritizing not only our community's short-term needs, but we're not losing sight of the very real need to reverse generations of inequity that have created this uphill battle that people of color must climb in order to lead happier and healthier lives. Our task force had 2 goals: to dramatically reduce the disparities in the mortality rate of COVID-19, and then to connect those interventions and learnings to our longer-term efforts to reduce inequity and enable opportunity. So the Margolis Center for Health Policy at Duke University released a study in February 2021, and the findings show that the average number of new cases for Black residents in Michigan dropped from overall dropped from 176 per million per day in March 2020 to 59 per million per day in October of 2020. Disparities in this case for race and Hispanic and Latino Americans also narrowed significantly in the state of Michigan. Our task force saw results, and we were able to see those because we took actions that were really critical to addressing these inequities. We established clear objectives and specific metrics to address the progress with hopes of designing and implementing targeted and effective interventions. We ensured there was a cross-sectoral collaboration and diversity within the task force. It was critical to make sure that everybody and every community was represented at our decision-making table. We helped to develop and strengthen sustainable public health infrastructure. We did things like delivering 6 million free masks through the Michigan Mask Aid Initiative, and it provided a free and easy, accessible way working with community partners for people to protect themselves and their communities. We administered 24,000 free COVID-19 tests in historically significantly underserved communities across 21 different neighborhood testing sites in some of the most deeply impacted parts of our state. We innovated, invented, and established a mobile testing infrastructure, drive-through and walk-up testing as well. I am from Detroit. We invented cars, so it makes sense that we invented mobile testing units in partnership with Ford and Wayne State University. We put systems in place to improve the quality of data reporting on racial disparities so that we could better address and understand issues in real time. We looked at every angle of COVID-19 from when an individual is diagnosed and then how to best help them recover. We looked at how to best respond to the social determinants of health as well, by providing resources like food boxes and hygiene products to individuals who were in quarantine from the virus. Those were some of the early steps we took during COVID-19. And then once 3 safe and effective vaccines became available to the public at scale, our task force shifted our attention to how best to distribute these vaccines in the most equitable manner. Task force members started working before the vaccines were even distributed on ways to address fears and concerns and questions and apprehension that exists for many reasons in many communities of color in our state. We recognize, frankly, the historical stain of racism and past large-scale medical interventions that it left whole when it comes to trust in the medical system. We also recognize that some of that distrust came from a lack of access to the system currently, presently, and today. And it's why we work to connect people with primary care physicians during the pandemic that they can keep a relationship with going forward, as well as access to health insurance, with hundreds of thousands of Michiganders signing up for insurance who previously didn't have it and now can afford it. We committed to listening to and answering questions of people in the Black, Brown, and Indigenous and other communities about vaccine safety and efficacy. And I'm proud that we built one of the largest, most equitable vaccine distribution systems in America. So in June of this year, we surpassed more than 60%, and we're at about 66% now of people who are 16 and older who have received at least 1 dose of COVID-19 vaccine. And the truth is, more people are signing up every day and getting the shot every day because this is our chance to end the pandemic on our own terms. So if Michiganders make that choice, we come closer and closer to more confidently growing our economy across the board, setting our path toward a stronger Michigan, which means creating a path to healthy economic opportunity based on the public health of our most vulnerable Michiganders. I'm always encouraged when I see more and more people making this choice, but the work is far from over, as the Delta variant has shown us. So we have to continue to make outreach, to make provision, and to provide pathways for people who have not yet made that choice to make that choice in the face of misinformation, outright lying, or folks who are trying to stand in the way of that. Our policymakers in Michigan are working to step up for it. So through the task force, we identified other critical actions that would, again, further reduce disparities and improve health equities within many cities across Michigan. So I've often said that this task force is really not your typical task force. One, we evaluate problems from several angles. And most importantly to me, we took action in real time. So Governor Gretchen Whitmer, for example, we stood up though and said something that needed to be said and had frankly not been said in a forthright way in Michigan ever. The fact that racism is a public health crisis. And while it was important to name that, we had to do more than just label this injustice. So we actively instead worked to take steps to just replace this injustice with actual justice, equity, and accountability. And our administration is dedicated to that cause, recognizing that we have to change at every level of government and society. So during July of 2020, Governor Whitmer and I became our state's first administration and one of the first in the nation to require implicit bias training, both for state government employees, as well as for medical professionals as a requirement of the issuing of new or renewal of their licenses. By providing access to these professionals on how to recognize and mitigate the impact of implicit bias, we're helping them carry out their mission of providing the best care and service to every person they serve. Implicit and unconscious bias, it exists within all of us and it takes different forms, but it can really impact the lives of others in terms of how we govern ourselves. So it's important for us to be mindful and cognizant of that. So this is helping to build a culture of understanding and inclusion to make sure that, frankly, state government can be a model for equality and fairness. The cooperation of state employees and our public health workforce and our medical professionals is really essential to making this work. And the governor and I are committed to continuing to work together to build a more equitable state and set of service providers. And that's why we are going to continue to dig in on this particular effort. I'm proud of the progress that we've made in reducing the staggering disproportionate impact of COVID-19 on Black folks and Michiganders of color in particular. But again, we still have work to do. The disparities will not end when this pandemic becomes endemic, unless we continue to intervene and to introduce equity into the equation. And so we're continuing to maintain our momentum, and we'll do so well beyond the end of this public health emergency. And it actually brings to mind for me the words of Nelson Mandela, when he said that after climbing a great hill, one only finds that there are many more hills to climb. And so that's what we're working to do, continuing to climb every hill that's put in front of us. Earlier this week, we announced our My Healthy Communities plan in Michigan, a $1.4 billion proposal that will expand care for families, build up facilities, invest in local public health infrastructure, all leveraging federal relief dollars that were delivered by President Biden, Vice President Kamala Harris, and the Democrats in Congress from the American Rescue Plan. For too long, for example, the state of Michigan has underinvested in our mental health infrastructure, which is going to be incredibly important as we emerge through this once in a century pandemic. So we need significant investments in comprehensive healthcare now more than ever. And our Healthy Communities plan includes increasing and diversifying treatment across our state, including a $335 million increase in capacity for community-based behavioral health and substance use disorder treatments, $20 million to increase and strengthen telemedicine infrastructure, another $20 million for respite care services for families who are providing continuing direct care to a loved one, and $19 million in support for foster parents. We are investing in the most vulnerable populations because they are our residents and our people. So I want to thank the National Academy for State and Health Policy for inviting me to be part of this conversation and for allowing me to discuss what the state of Michigan has been doing as we work towards health equity for all Michiganders, regardless of socioeconomic status, color, nation of origin, gender, or zip code. We can do this together. Thank you so much.
Well, I am incredibly honored to join you all today. I want to say a very special thank you to the National Academy of State Health Policy. And Hemi, I'm so honored to share the stage with you today. I'm incredibly honored to share the stage, the virtual stage, with Lieutenant Governor Gilchrist. And I have a special place in my heart for the Honorable Dr. Janice Underwood, because when Indiana was exploring standing up this new initiative that my office is overseeing, she provided us a really great blueprint and gave us some great feedback. So we are so grateful for her guidance in this space. I'm so grateful to bring you comments on behalf of the great state of Indiana and my governor, Governor Eric J. Holcomb, the 51st governor of the state, equally as honored to represent our Lieutenant Governor Suzanne Crouch, who has been a great partner for me in the veteran space and exploring opportunities for people with disabilities across our state. I just want to share a few things that Indiana has done to really make sure that equity is a through line of everything that we're doing with our state government operations. I'm also very grateful to the Biden-Harris administration and the COVID-19 Health Equity Task Force, as we do have representation on that task force as well. Mr. Tim Putnam of Batesville, Indiana, is representing our great state, and we're grateful for the work that he's doing with that task force, and Dr. Nunez Smith. So a few things that I want to highlight. First, just the amazing work that our State Department of Health has accomplished over the last year and a half, really digging into the inequities that have existed in our healthcare system and making it a strategic priority to ensure that our most vulnerable populations were a focus during this COVID-19 pandemic. Dr. Christina Box and her team have been fantastic. And I just want to highlight a few of the things that were top of mind for them as we started this process of trying to figure out how we were going to approach COVID-19 together. There was abundant and frequent communication. They did weekly press briefings with the commissioner herself and the governor. The online resources for COVID-19 through dashboards and mapping, testing site information, vaccination site information, marketing resources, testimonials, public and professional resources were dynamic. And we will share those links with you all if anyone wants to see some of those resources. But some of the really strategic steps that they took in an equity strategy, they overlaid vaccine uptake with the CDC's social vulnerability index map and worked to improve outcomes in those areas. Specifically, they looked at vaccine uptake by gender, by race, by age, and location, and then used that data to drive resources to our most vulnerable locations within the state. They hosted countless meetings with our hospital systems and LHDs to detail SVI uptake, and then assist providing the vaccine to underserved populations that showed up on those mapping strategies. They worked with external partners like the faith-based groups and advocacy groups and others to identify preferred locations for testing and our mobile sites and vaccination sites. And mobile units were sent to communities with low vaccine uptake, and priority was given to communities that also had a high SVI. One of our examples in Gary, Indiana, we had low vaccine uptake and a high social vulnerability index. And so the State Department of Health partnered with FEMA to implement an 8-week mass vaccination clinic, and 60,000 people were vaccinated at that site. We had a great campaign during the pandemic called It's Our Shot, Hoosiers, a $1.4 million public awareness campaign, which utilized diverse voices. It was presented in multiple languages. It really used some of those key community leaders to drive the conversation and to dispel the myths and fears around the vaccination effort. And we partnered with our state's internal data team, MPH, to provide every Indiana county the odds ratio for vaccinations based on race, gender, and age. Finally, and we'll share these links, there was a toolkit that was created for medical professionals to discuss the vaccine with patients and provide ample resources. And I will tell you, I'm so proud of our efforts here at the state of Indiana because of those efforts. Of the percentage of Indiana population 12 years of age and older, when you look at our Black or African-American population, they make up about 9.6% of that population. And to date, 6.9% of them are fully vaccinated. Our Hispanic or Latino population, they make up 6.5% of the Indiana population 12 years of age and older, and 5.9% have been vaccinated. So those efforts that the State Department of Health have implemented have given us some really great outcomes. We still have a ways to go. The other thing I want to highlight is I'm so grateful to Governor Eric J. Holcomb and his team for creating this cabinet level position, the Office of the Chief Equity, Inclusion, and Opportunity Officer, so that we can work, my office can work with every state agency to really explore how equity is a part of the work. It has to be operationalized and normalized into every aspect of state government services. And so I just want to highlight a couple of really amazing things that have happened since I took office and joined Governor Holcomb's team in February of this year. Number one, we've started writing all the position descriptions. I've met with over 70 different meetings with over 200 stakeholders to really carve out what the strategy will be for this office to partner with our state agencies. So our website, in.gov/equity, is now up and running. And on that website, we have what's called our Indiana Equity Data Portal, which really is a resource for Hoosiers to go to and look at our numbers when you think about infant mortality, preterm births, when you think about workforce development, education attainment, and high school graduation rates, when you look at the rearrest records and arrest records and recidivism rates. And so all of these numbers are available so that Hoosiers can see how we're doing as a state and then hold our office accountable to start to implement strategy to see those things change. A big focus over the next couple of years with our administration will be to look at equity through the lens of workforce development, economic development, and community development. And I'm so grateful to partner with my peers across the state and the various agencies to ensure that we are thinking and keeping our most socially and economically disadvantaged Hoosiers top of mind. I'm incredibly grateful that the state of Indiana has taken a hard look at how our minority populations are experiencing quality of life by using the social determinants of health to see where we need to implement changes in our communities to make them stronger, so that we have stronger cities, a stronger state, and ultimately a stronger nation. Incredibly grateful to Dr. Janice Underwood for the guidance that she provided us, and I'm looking forward to that. Please know that there will be links available for you to check out our equity data portal, which is a groundbreaking thing that we're doing here in the state of Indiana. I'm looking forward to setting the strategy by using that data because we believe heavily in data-driven outcomes and using evidence-based analysis to show the effectiveness of how we drive resources to these initiatives. So I'm very much looking forward to that. The last thing that I will share is that we just must always keep in mind that there is a history of tough things, and Lieutenant Governor Gilchrist, he alluded to this, the challenging history of communities of color with the medical profession. We cannot forget about Tuskegee. We absolutely cannot forget about J. Marion Sims and the use of enslaved women to test out, the gynecological, operations. It's really things that are still heavily on the tops of the minds of communities of colors across the country. And so we have to really be mindful of that and understand that these communities are not a one size fits all. And we have to work with the various groups that can help us really tap in to how to better support those communities. I'm really honored to be here today, and I look forward to meeting some of you. We will make sure that our contact information is available. Please feel free to reach out to the state of Indiana, and we're happy to help however we can. Thank you, and God bless.
Well, hello, everyone. And on behalf of Governor Northam and Lieutenant Governor Fairfax and the residents of the great Commonwealth of Virginia, thank you to the National Academy for State Health Policy for inviting me and this powerhouse closing panel to provide some brief remarks. I am especially honored to share the virtual stage with all these all-star public leaders, Lieutenant Governor Gilchrist, Diversity Officer Karrah, and all of you who have joined us today. We have begun to truly build a professional learning network along with the National Governors Association, Duke Margolis, the Biden administration, Dr. Nunez Smith, and Dr. Cameron Webb from the Commonwealth of Virginia with the White House Health Equity Task Force. I can't wait for all of us to be together in person soon. Building from what Lieutenant Governor Gilchrist and CDO Herring have talked about, I want to challenge you to think about these things from a macro perspective now and take what you've discussed and learned outside of the choir and make good trouble by promoting and advocating for structural change in your respective spheres of influence as both change agents and peacemakers. I want to frame Virginia's equity work across secretariats from the perspective of our past, our present moments, and looking ahead to our future. In the past, the historic structures of racism, which were touched upon by our other speakers, were designed to create systems of supremacy. So we need to talk about that. They were designed to sustain enslavement and exclude communities of color and women. These systems were never erased and have only evolved. And today, discrimination is not as explicit as Jim Crow, but instead exists in all of our systems as what I like to describe as James Crow Esquire or Jim Crow 2, which is a bit more cunning and insidious and easily overlooked because it's been normalized and is embedded so deeply. Discrimination at one time was legally protected and accepted. But now, after much hindsight and hundreds of years, we recognize, or at least we say out loud, that education and opportunity are meant for the benefit of all, regardless of your color, gender identity, tribal affiliation, or zip code. Today, we publicly acknowledge that clean air and water and civil protections and justice under the law is supposed to be a right for all. And while everyone on this Zoom call and all of my esteemed panelists can agree on these statements, the reality is that they ring hollow for many of the folks that we serve, for many underrepresented and disadvantaged communities, because there has been both a deliberate and unintended effort by the haves to hijack power from those who have less, or worse, we use our power as well-intended allies to ultimately advance inequitable policies and practices, all the while claiming an anti-racist ideology. Most of you know that Virginia and our nation have not always gotten it right. Actually, as I think about it and reflect on my own equity journey, all of us have made mistakes and actually contributed to the structural flaws of our own states and our own nations and the systems by which we all operate in. But now we have a chance, an unprecedented opportunity, which has been never more clearer to me now with all of us joined together to shape the public discourse and make federal, state, and local levels of government amenable to these kinds of structural reforms that Lieutenant Gilchrist and Karrah have been talking about today, and that you've been discussing throughout this entire conference, so that as a collective, we all get it and move toward building inclusive excellence. Now, I have to be honest with you that these challenging conversations are uncomfortable, and I get that. But as we push for inclusion and equity, we have to be vulnerable and honest about our structures. In 2019, before the pandemic, after doing a lot of listening, Governor Northam wanted to have an honest and challenging conversation about these things and created the position of Chief Diversity Officer, for which I'm in now, to help him and the Commonwealth intentionally think about ways equity should be threaded across all of our public sectors, our state workforce and beyond. And in 2020, I created the Governor's Office of Diversity, Equity, and Inclusion, or the Virginia Office of DEI, and we immediately got to work. This position and office were codified for every future administration to build upon the work that has already begun. And I hope that your states not only create these positions, these kinds of positions, and fund them equitably, but also codify them so that they don't go away or they're not scraped off like icing on a cake. And believe me, it will take generations to see measurable outcomes or dividends from what has been invested, but we have begun to see the fruit of our work. For example, in 2021, we launched the first statewide strategic plan. Yes, statewide DEI strategic plan, the One Virginia Plan, and House Bill 1993, which mandates that all state-supported institutions establish and maintain a DEI plan to drive culture change across all state agencies, colleges, and universities, shook our state and nation, but we're doing the work. This has also become a model for other states and even the federal government. Virginia has been investing in DEI public policy and reform, and as a result, won the best state for which to do business, in part to our commitment to our diversity infrastructure. And there will be a link that you will have available to you that you'll have access to what we call the One Virginia Toolkit, which is replete with resources for you to create a DEI plan based on the Inclusive Excellence Framework. What hinders progress is an honest examination of how our systems, our public health systems, for example, have developed throughout our shared history, right? And Karrah talked a little bit about that, but we haven't been having honest conversations about that mistrust in government, in public health, and law enforcement, for example. And those conversations have developed throughout our shared history, and they've become divisive, and hurt people hurt people. And these are the people who are not willing to be vulnerable about these histories. It's also such people who view DEI as some kind of transactional activity, or those who perpetuate a false narrative that slavery never really existed, or that it does not affect our present reality, or talking about it somehow is what makes you racist. In my role as the Commonwealth of Virginia's Chief Diversity Officer, this reality, like for many of you, became glaringly clear during the COVID-19 pandemic. In our response to COVID, the governor created the Health Equity Working Group and Leadership Task Force, and this team worked tirelessly as part of the COVID-19 Unified Command to thread equity from a whole government approach in our response and recovery efforts, and has become an exemplar for others. But in the same way that COVID-19 was declared a public health crisis that disparately impacted underrepresented communities, many groups in Virginia, much like in Michigan, advocated in May 2024 a statewide declaration that racism was the larger public health crisis and an urgent emergency. So in addition to our equitable response to COVID, the Commonwealth of Virginia passed House Joint Resolution 537, which declared racism that larger public health crisis across several social determinants of health. And I would just like to say that much like in Michigan, we had to figure out what's the so what, now what? Now that we've made the medical diagnosis, what do we do about it? So in reaction to this declaration of racism as a public health crisis, we created a historic mechanism that makes inequity visible, and less nebulous across social determinants of health. As the mechanisms, while only a start, are 2 health equity dashboards, and those dashboards are commensurate with House Joint Resolution 537. At their core, these dashboards dispassionately measure the pervasive ways racism is synthesized across 6 determinants of health, 133 localities, and by race and ethnicity. In the links, you will find access to these historic dashboards, and I welcome you to go to them. The Equity in Action dashboard celebrates the historic resources that Virginia has allocated across the COVID-19 response to provide our residents with transparent views of where we've actually invested and spent the CARES Act money, the American Rescue Plan money. But the Equity at a Glance dashboard is one I'm really excited about, is a call to action for our state and local policymakers to examine the equity gaps that exist and direct and invest future resources and solutions to remedy those gaps. We are hoping that champions like you begin to see the value that these equity dashboards are and represent as a synthesis of the social determinants of health that are represented there. And hopefully this will galvanize productive, meaningful equity policies in Virginia and in your states and spheres of influence, as you all perhaps consider creating the same kinds of mechanisms. I'm really excited about the work that we're doing in Virginia across secretariats, for example, that become larger, part of the larger discourse, such as the first ever Voting Rights Act in Virginia, and so much more. I've said this before and I will say it again. Structural discrimination and inequity operationalizes and justifies the forms of oppression that we interact with daily. So the Virginia Office of Diversity, Equity, and Inclusion is driven by the following premise, along with those who you see on the stage today. We have to accept that our systems are not broken, rather, they are operating in the exact way that they were intended to function, inequitably, and it's up to us to do something about it. Thank you so much. Turning it back over to you.
Well, thank you to all of our panelists today. That was, I think, just inspirational to listen to. And I hope everyone out there listening has new ideas and inspiration as they think about this work. In a couple of places, Dr. Underwood and Chief Officer Karrah referenced some resources, as well as Lieutenant Governor, the case study in Michigan. Those are all available just directly below the streaming. So you're able to get those resources. We also can enable connections with each one of these speakers after the event if you don't already have their contact information. So I want to make sure that everyone can be in touch. So we have a couple of minutes left for the discussion part of this panel. And I just wanted to ask you all to reflect, and I think you answered this in a lot of your remarks, as state leaders who may just be beginning this journey, what would you share in terms of some of the immediate challenges they may face and how they can start thinking about sort of sustainable focus on equity as we start to hopefully come out of this pandemic? And I might just go in reverse order. So I might start with you, Dr. Underwood, and let you answer that first.
Well, I appreciate that, Hemi. Having started the work in 2019, pre-pandemic, what I learned was that, this work is so incredibly nuanced and complicated and fraught with equity implications in and of itself, in part because a lot of times folks who are leading this work are members of marginalized groups. And so what that means to me and what I want people to take away from that is that we all have a role to play. And building a coalition of allies and support in what I call a 21st century underground railroad is going to be so important to that support and to the success of those who are just starting the work. And so I encourage the folks in the conference to reach out to me and Karrah and Garland and say, hey, how can we build community? How can we really further this work? I need help, because I will be reaching out to some of you to say, I need help. This work is difficult. It's challenging. It's psychologically and emotionally and spiritually and physically challenging. And so we need to take care of one another in this work, recognizing that we're going to hit highs and lows, and really holding each other's arms up is going to be so important. So I really recommend that you have a system of support, and it may just mean starting with building relationships. And on a final note, I'll just say that you need to also be prepared for those well-intended allies who will unknowingly or knowingly try to sabotage the work, because everyone exists on a continuum of awareness and understanding for this work. And so those who you are sort of working with or, bumping elbows with in a safe, COVID-friendly way, they may be the very ones who are stabbing you in your back. And you might come to this work as a young Thundercat, but just know that you need to build coalition with them and learn diplomacy. And you see me in this jacket today, but I can take my jacket off and we can begin to really duke it out, so to speak, verbally, because I need to be able to articulate the plan, the return on investment. So when you come to this work, be ready to articulate the return on investment for this work and dispassionately use data, because we're not here to convince people that there are problems. We're here to move the needle.
Nicely said. Karrah, your thoughts?
Yes, I agree wholeheartedly with Dr. Underwood. And just to echo some of what she said, just making sure that the work is data driven, right? We do have to show the return on investment of this work and show how this creates stronger economies for our state. It enhances the quality of life of all of our citizens within our states. And so really making sure that that is a priority. What I will say, moving forward, I think that states have to really commit the same resources and strategy that we have during this COVID-19 pandemic to other health issues affecting our most vulnerable populations. As we start to look at maternal and infant mortality and preterm births and proactive health screenings in the Black and Brown community, healthy lifestyles, and looking at the social determinants of health, physical activity, and diet and nutrition, education, the same way we took a strategic focus on how we could really drive and get those vaccination numbers up and get the COVID-19 positive rates down. We're going to need to do that with those other areas as well. And that's when we'll really start to see the quality of life change. And the last thing that I will say is, as Dr. Underwood has done this in the Commonwealth of Virginia, and we're doing this here in the state of Indiana, really making equity a priority and thinking about how you can get this work codified into statute so that it's sustainable, regardless of who's in the offices that we sit in, who's in the seats that we sit in, because this work needs to continue. Maybe in 30 years, we won't need chief equity officers. Maybe we won't need them in 30 years, but right now we do. And so no step is too small. Your state can do something like Dr. Underwood said, start the conversation And I just want to say thank you to Lieutenant Governor Gilchrist. He's a neighbor. He's close. I'm coming up there to see you. I got to learn some more from you, and hopefully Dr. Underwood will join us. You all were fantastic. But those are my thoughts. Thank you so much.
Thank you, Karrah. Lieutenant Governor.
Thank you so much. I appreciate the perspectives from both of these dynamic leaders here. And what I'll add to what they said is that I think it is important for us who are working to deliver for the people of our states that we, in addition to what they said, that we also show both short-term impact and the trajectory for long-term impact. And so one of the things, that's why the Michigan Coronavirus Task Force on Racial Disparities, for example, explicitly defined 2 objectives. One was to reduce the mortality rate disparity, and part of that was due to the urgency of the fact that we had this novel virus that was killing people quickly. I mean, just to be real about it. Like, I would get text messages every single day in April and in May. Somebody else I know contracted the virus, and 3 weeks later, we said our final goodbyes. And so it was important for us to show the value of this effort. And what we did by, flattening that mortality rate in Michigan, going from, Black folks representing 40% of the deaths, representing less than 4 in a matter of 10 months, is we showed that when you focus on a problem, you can make progress toward its solution. And so we wanted to make sure that we could demonstrate the credibility of these interventions by protecting people and saving lives in the immediate term, and to have that be the foundation of our argument for why these types of interventions and programs and approaches need to be funded, need to be positioned sustainably within state government and amongst our local government partners and our community partners, so that we can continue to walk this path together towards collective health. And I think any intervention that is able to demonstrate, again, short-term long impact and the potential for long-term impact is one that is a little bit easier to build a coalition of support for.
Yes. Thank you for sharing that. Great reflections. So we have a couple of minutes left, and I'm going to do a last lightning round of, given all of this rich discussion, what are your sort of last thoughts for this audience, and really would appreciate just your, off the cuff, what haven't we said yet and what should they hear? So I'll just go in reverse order again now. And Lieutenant Governor, you get the first bite at this apple, and then we'll end with Dr. Underwood. So go ahead, Lieutenant Governor.
So I think what's important for us to recognize is, again, that even problems that have persisted for generations or for centuries do have solutions. And so it's about us being courageous enough as public servants to recognize that progress is both possible and necessary. And in the current context that we are working in, where we are facing, historic political polarization, we also have to make the case that public health is good for everybody. It's good for everybody. Like, people being healthy is a good thing. It is good for not only our well-being, it is great for our economy because healthy people participate in commerce. Healthy people engage with one another in education. And so I think it's important to connect back to the collective impact of focused interventions on people who are hungriest for the most support. That these things should not be mutually exclusive, that it's not zero sum, but instead it makes the sum greater. And so I think if we take that approach, we can see better outcomes for our states, for our nation, for our communities.
Great. Karrah.
Yes, I try to remain pretty apolitical and not get involved in that, but this is something that I do have to say. This is a Republican administration in Indiana, and we have made this a priority. Equity is not a scary thing. And to echo Lieutenant Governor Gilchrist's comments, equity is positive. It enhances our collective experience as citizens of this great country. And so when we think about the way we want to see our economies thrive and education and workforce thrive, as we implement these equity initiatives, our citizens become assets to our states and our economy instead of burdens because of some of the other pathways ways that they can go down. And so I would just say that regardless of where we fall on the political spectrum, this is something that is positive for our entire nation and the health of and the quality of life of all of our citizens. And so as someone representing a Republican administration, this is doable. It's not a scary thing. And if you have questions about how we're doing this, reach out. I want to be a support to you. Thinking about the communication and the way that we talk about this and how to use universally palatable language to bring everyone to the table is a really powerful tool. And I'd love to assist any of you with that. So thank you for this opportunity. And I look forward to working with many of you.
Thank you. Dr. Underwood, last but not least. Uh-oh.
Okay, I'm sorry, I was on mute.
No
Story
worries.
of our lives. I thank you for those final remarks to my esteemed panelists. I guess the main thing is, what's the call to action for the days ahead for all of us? And if we face our history, as was mentioned, and tell that more complete and complex story of our communities and nation, then we will be able to restore and heal our land in a nonpartisan way. And so thank you for talking about it from an apolitical standpoint, because this is just good, just makes sense. It's good business sense. It makes sense for people. So as a recap, Virginia is doing the work. We're linking arms with many of you who are doing the work and want to continue to build that professional learning community. We've codified the position of Chief Diversity Officer and built an equity infrastructure so that this work in Virginia can be sustained. So we need to hold all of our policy leaders across the political spectrum responsible for this work, because it's not just my work, it's not just Karrah's work, it's all of our work, right? We created an initial office and statewide DEI framework, the One Virginia Plan, for all state agencies, colleges, and universities, declared racism a public health crisis, dispassionately used data to measure the persistence of racism across social determinants of health, codified our equity leadership task force for all future emergency declarations, because we know COVID is not going to be the last emergency declaration that we face. And we've passed historic equity-minded legislation across all of our secretariats. Well, what comes next? Moving forward, we must hold all of our decision makers, policy makers, government leaders, and I mean all of them, accountable for this important work. We don't want these groundbreaking hashtag diversity wins to go away or be diminished. I often say you can't change what you don't measure, and you can't measure that which you don't acknowledge. Now that we've all on this call acknowledged it, let's keep making inequity visible so that it can be seen and addressed. In the days, weeks, and months ahead, we must strengthen the One Virginia mission across state lines and really think about building that equity infrastructure among all of us, that larger macro professional learning community, because we're going to need each other. And lastly, individually, we have to work to break out of our silos and, yes, reject our egos and roll up our sleeves and get to work. Collectively, we have to continue to acknowledge that inequity has been so normalized that it's endemic. It's not something that lives in some abstract other place. And I love that Lieutenant Gilchrist said this. It's not beyond the confines of our lives. It resides in our organizations, on your team, maybe even next door to you, in our neighborhoods, grocery stores, schools, all of our systems, companies, and public policies. So we must stop imagining DEI work as some ambiguous moral imperative. And instead, we need to think about DEI as tangible practices and policies that can inform and reform our daily operations to lead health equity for all. We're doing the work in Virginia. As you can see, they're doing the work in Indiana and Michigan, and I hope that you all join in. Let's go out there and get in some good trouble.
Well, thank you for all of that inspiration and energy. I just have to say, I'm so pleased that you all were able to be here and share all that with our audience today. I'm the new executive director here at NASHP, and I'm deeply committed to equity. That's why we ended the conference on this note with all of these fantastic leaders. They are offering to reach out. You should reach out. We can help facilitate that if you don't already know them, and share those resources, which we're doing with you now. We also, as you all know, have an equity work group that we have launched and continue to grow. And, I believe states learn from states. So let's do this. Let's make sure we keep the momentum up. As all of these speakers have noted, we really need to work with one another. So thank you all for the work that you do every day. I know it's difficult work, it's inspirational, and we will do what we can to help support you in that here at NASHP. So all be well, and good to see you all on the screen, and one day, hopefully soon in person. So,
yes.
Okay. Bye, everybody.